right, welcome to the Life Science Rundown. This is Nick Capman with the FDA Group. Before we jump into our discussion for today, just a little bit about the FDA Group. We help life science companies in the areas of quality assurance, regulatory affairs, clinical operations, commissioning, qualification, and validation, as well as manufacturing and engineering. We offer 3 engagement models, which are consulting projects, staff augmentation, and full-time employee recruitment. So if you ever find yourself in need, just head over to thefdagroup.com and check us out and get in touch. So today, I'm speaking with Tobias Kuners of Koenders, if I pronounced that correctly. And we're going to be talking about a paper he wrote titled Quality Management Review, Benchmarking Quantitatively. So I had an opportunity to catch the paper that you wrote on LinkedIn, and I read it. And as is typically the case with these podcasts or vlogs, whatever terminology people prefer, in the back of my mind, I said, this is cool. And that's the trigger for me to want to have a conversation and explore the content a bit more deeply. So with that said, thanks for hopping on and joining me. And maybe to get started, do you want to just kind of introduce yourself, and then we can transition into, what you wrote and what your thoughts are?
Very good. So like you said, my name is Tobias Kuners of Koenders. I'm a Dutch resident living in Europe, and been working as an independent self-employed consultant for like the last 10 years, working in pharma industry for over 20 years, and have worked on the operational side most of the time. And now with being consultant, also working as a QA rep and making sure that the organizations follow current regulations.
Excellent. So let's start at a high level. Why don't you tell the audience a little bit about the paper you wrote? What was the inspiration? What did you learn as you were writing it?
Yeah, so the QMR, Quality Management Review, is a requirement that pharma companies have to host a meeting more or less every month, in which they look at all the quality metrics in the organization and make sure that they stay current with reducing the number of deviations and CAPAs that they have, and make sure that they are addressed and closed out timely and don't affect the patient safety or the product quality. And what I've seen over the years is that it's always a challenge in these meetings to keep enough focus and to really address the issues at hand. So in a lot of situations, people will just talk about the metrics. So this many deviations were added last month, and these many were closed. So many CAPAs were opened, and so many were closed. And then the meeting is typically adjourned to next time. And people have too little time to dive into the real matters that are in need of discussion for instance, support from senior management, or projects that need to be initiated in order to resolve issues that are there in manufacturing or in facilities, in QC or what have you. And my paper provides an angle of looking at it more quantitatively, so bringing the finance department in there and setting up metrics where you make a percolation basically from senior level high up, for instance, something like the return on stock, and all the way to the bottom where you say the amount of water consumption in rinsing for the operator at the machine and how they relate to each other, explain that to people and make it possible that you have leading indicators at the shop floor and lagging indicators at senior management level.
Mm-hmm. How many companies do you think utilize your philosophy in one way, shape, or form, and how many do you think don't?
Well, in numbers, I'm not sure that I could mention one, but in percentage, it's a small percentage. It's like a quarter of the organizations that really do that. Most of them are led by the quality department, and they invite all the support departments like manufacturing, like facilities, like supply chain, logistics, distribution, those kind of departments. And they all share their deviations, kappas, and also relationships between them. But very rarely do you see them in that they bring in financial metrics where they say, this deviation is costing us 15,000 or 5,000 euros or dollars to resolve. And the sooner we do that, the less cost we have in the process.
Yeah.
And one of the things that I shared in the article, for instance, is if you take a batch record review, everybody has that. Typically, there's metrics around that of how much time it can take within the QA department to review the document. But in order for QA to properly review that, they have to get a pristine document where there's no voids, where there's no mistakes, where all the signatures have been put in. And very often you see that manufacturing, because of the speed of work that they are at, fail to fill out the document completely, and it has to go back and forth between manufacturing and QA 1, 2, or 3 times. And there you lose lag time to complete the document. The finance department, on the other hand, is waiting for the batch record to be signed off by the QP, by the qualified person, so that they can invoice, for instance, to their customers if they're a CMO. And this is precisely where all the departments see the benefit of working together properly and helping each other in being efficient and effective in the document process.
It seems like the primary reason that more companies aren't taking this approach is a lack of time. Is that correct? Or a perceived lack of time?
I would say perceived lack of time, because nowadays with the Internet of Things and computerization and digitization, most or all the companies have some sort of an ERP and enterprise resource program in which they track all these data and all these numbers. And setting it up will take you a little bit of time, because you have to design your metrics, agree the way that you calculate it, and make sure that people get the data in time in order to make the measurements. But once set up, it's more or less the click of a button in order to make a summary statement. And then you can assess them within your team and within your department. You can come up to the QMR once a month, and you can present your situation, and you can also demonstrate where you're saving money for the organization, or where the lack of decision making in the QMR may in fact cost the organization money for the fact that they do not take a decision.
Yeah. For those that are listening, I have 3 thoughts. First, who needs to hear this the most? Second, what is the 1 to 2 statement explanation about why they need to be taking this into serious consideration? And then lastly, how are they going to overcome their perceived lack of time and or other potential objections?
Right. So this is typically a topic that has to come top down. So senior management has to really show interest in these numbers, both the qualitative as well as the quantitative numbers. So, and then they bring in the finance department and all the department heads to design the system. And that may be an iterative process that will take you 2 or 3 sessions. And why they need to do it? Well, what you often see is that, like I mentioned with the batch record review, people are prepared to bring the document back and forth between manufacturing and QA to get it completely filled out and properly signed off in order to release it by the QP and have it paid out by the customer. But they are not willing to invest a little bit more time upfront and do like an assessment before they hand it over to QA and say, well, this document now is ready for review. It's like having a blue hat where you do the coaching and mentoring between the two teams, manufacturing and QA, or where you have the red hat where you do the review and say, oh, what is missing, and then send it back and lose unnecessary time.
Mm-hmm. Is this something that you believe companies that aren't already implementing something like this can do on their own? Or do you think it's something where they could benefit from bringing somebody from the outside in to guide them and help set up the system?
I definitely think that it would be helpful to bring somebody from the outside for a multitude of reasons. And maybe the most important one is that in order to implement something like that, you need a little bit of coaching and mentoring so that people take the right definitions of certain metrics, and that there is a hierarchy in the metrics that is consistent and coherent across the board. So within logistics, within manufacturing, within facilities. And at the same time, it allows you to play a good guy, bad guy. So you have the outside person that does the support be the bad guy of implementing this and getting all the agony over him or her. And then the department managers can remain the good guys and then implement the system as such.
What do you think the biggest challenges and hurdles would be to implementing a system like this? And what would be the biggest challenges and hurdles for maintaining a system like this?
The biggest hurdles for implementing this is trust, obviously. In other industries, you see something like open book management, where they advocate the system where if you are transparent about all your costs and decisions and why you do as you do, that you run a more smooth and a more advantageous business. And there also trust is a big issue. And that's typically here also, because the moment that you make clear that a certain deviation or a kappa takes an amount of time and money, and people say, well, I don't have the time to do that. Typically, they're being questions why they don't have that, and they feel uncomfortable with that. So you have to take away that angle where they say, it's a person thing instead of a system thing. So if you design the system properly and if you design it with the proper intent, people can deploy it effectively and efficiently, and they will like to demonstrate where they're doing good, where they make improvements, and how they are contributing positively to the organization. It's like the human error. A lot of pharma companies have learned over time that human error is typically given by poor systems design. And if you have a pit in the road, then you're likely to trip over that. So if you flatten the road, there's no risk of tripping. And that's also in the human behavior. If you allow enough time for people to properly fill out a batch record, the likelihood of filling it out first time right is a lot bigger than when you rush people to quickly hand it over to QA.
Yeah. And I think the paper that you wrote was about 6 to 8 pages, and we're touching a little bit on the content. Before I move on to some of the other questions I had, what are some of the other details of what you wrote that you think maybe we have glossed over in the short time we've been speaking that's important for people to know?
Well, the thing that is important probably to know is that you can do this at a site level, you can do this at a divisional level, and you can do this at a global or corporate level. So likewise, organizations, and there's many that have facilities all over the world, manufacturing facilities that make same or similar products in different regions of the world, they can compare each other on efficiency and output and all those kind of things. So that's a benefit for the organization. And with the recent pandemic, where there's a need for regional spread of manufacturing capabilities, this may be a tool that they want to use in order to clarify why it is advantageous to produce in the United States and in Asia and in Europe, and not just bring everything in from one single region. Mm-hmm. So that may be a situation where they say, and within a site, you can compare the efficiency of like the facilities and maintenance department with the logistics department, with the QA department, and with manufacturing on the closeout of deviations or the conclusion on corrective and preventive actions. Mm-hmm. So at all different levels in the larger organization or at the facility, you can do it cross departmental and across divisional.
And how do companies make that determination?
Well, if you have the executive committee buying into it, typically it's percolated through all the divisions and all the sites. And if you have like an enthusiastic regional director, then it's typically done at site level. And then when you demonstrate that, other organizations within the group will also buy into the system and use it. Simply because you also take it away from the personal aspect. You look at certain numbers and you look at improving your system. You're not trying to improve the people, but the improvement of the people is a consequence of the fact that you streamline your system processes. Mm-hmm. Like I said, if you have a pit in the hole in the street and you trip over it and you fix the hole, then people don't trip and they move on faster.
Right. And you mentioned this should really come from the top down. So that one question I would imagine is, all right, if I'm going to invest in this, what's the give and take? What am I giving up when I decide to invest in this and pass it on throughout the different departments and divisions in my company?
Well, I'm not sure that you're giving up something. I think you're gaining a lot because you gain transparency throughout the organization. You become to discuss systems improvement that lead to cost reductions or waste reduction in a number of situations. And that frees up time that you can then invest in quality or new products or those kind of things. And with the scrutiny of the society on cost reduction for drugs in general, that's something that you need to be prepared for so that you can absorb those cost reductions or those revenue reductions and still be profitable going forward.
Mm-hmm. Yeah, and so I can imagine the audience listening and saying, well, yeah, this makes a lot of sense. I can see the benefits to an extent, but I know I'm going to have to bring somebody in and I'm going to have to pay their hourly rate, and it is going to take up time and resources. So can you paint a picture, a before and after picture of what a company might look like, generally speaking, in terms of quality and cost expenditures prior versus quality and cost savings after?
Well, I've done that a little bit in the article that I wrote, where I provided a table and where I demonstrated, and this is a real life situation that I managed many years ago, where they had a lot of waste reduction due to the fact that they trained the people. And we came to recognize that because we set up the metrics in order to manage the organization. And if you look at any organization today, they have some degree of metrics already in order to guide the organization, because you have a volume of manufacturing and therefore you need a team of people to do that. And the only thing that you need to do there is you need to standardize it, and you need to formalize it. And by doing so, you start to talk about the certain topics that are relevant for improving those numbers. So, of course, it would be the best solution to bring in external resources, but I can also see with a larger organization where they would bring in a corporate team that would do like a round robin exercise, where they bring the standardized way of working from one side to the next. And they could implement that in a matter of, well, I would say within a quarter, they could implement that, where you have different levels of ownership. There's nothing to begin with, and then you start designing it, and people take ownership of those metrics, and they take them over from yourself as teacher and trainer, and then they enhance it even. And then you can move on to the next facility, and you will see that there is an effect that if one organization demonstrates a good progress there in terms of making less errors, having to do less rework and those kind of things, that other facilities will say, well, we want that too. Because there's no employee in any organization that wants to do the same task twice because the first time they failed. So if they get tools and systems that help them to do it first time right, everybody likes that. The pitfall that you have is that with these kinds of improvement processes, they're often recognized as a way of headcount reduction. And the moment that you start using it as a headcount reduction, people will sense that very early on already, and they will be less cooperative in implementing such a system because they fear the jobs. So that's a human behavior that you have to be mindful of. And the moment that you implement it and you see it as a system enhancement that allows people to go home early or to have focus on new products or better quality, people will definitely participate and enjoy that.
That's a good point. So framing this is really important.
Mm-hmm.
Yeah. What else would you add to that?
What else would I add to that? Well, like you said, typically senior management or executive management, they want to see a timeline for that. And there's real simple tools and techniques to demonstrate if you have nothing and are at the zero level, or when you have 5 and people have taken ownership. And with the teams that you work with, you can agree over a time frame of like 10 weeks or 12 weeks to go from stage 0 to stage 5. And present that to executive management so that they have a sense that things are in control and that they will see the benefits of that. And then when people really work on that and for themselves recognize that they are doing a batch record review first time right, and the lapse time for turning around a batch record reduces from like 5 days to 3 hours, they do like that a lot. And the time that they free up, they can focus on the issues at hand, which there are plenty and many. And yeah, that gives fulfillment to their jobs and a variety to the jobs, which will motivate them even stronger.
Good point. Well, similar to your article, your explanation has been well delivered. So it's easy to understand the benefits, and while there is some time that needs to be invested and resources that need to be invested in order to get to this place, the obvious benefits outweigh the investment. So with that, what would you like to leave the audience with? What are a couple, final points of mention?
Well, maybe the real final point that I would like to make is that if you look at the FDA, but also the EMA, the European counterpart, they are driving the industry to quality metrics reporting to reduce the inspection burden on the organization. And this is a great way forward to design your own metrics and demonstrate, firstly to yourself and secondly to external parties, that you have all of your quality metrics under control. And that's both for the FDA, the qualitative part, and it may be for your investment, the quantitative part, which will benefit. So you can wait by doing it, but in due time, some kind of system needs to be in place that will provide these qualitative and quantitative metrics that industry needs in order to satisfy the stakeholders.
Yeah, excellent. Well, thank you very much for that. That was super helpful. And I'm sure the audience really appreciated your explanation. So thank you for that. So as always, if you find conversations like this valuable, please share it with a colleague or your professional network. If you haven't already, subscribe to get updates of new episodes at thefdagroup.com/podcast and follow the FDA Group on LinkedIn. If you'd like to connect about project or resource needs, head over to thefdagroup.com to get in touch, or feel free to connect with me personally on LinkedIn. So thanks so much for tuning in, and we will see you next time.